Hi, I'm Dr. Tubbs. Let's talk about PRP and stem cell injections for acute and chronic shoulder pain. Shoulder is actually comprised of several joints that combine with ligaments, tendons, and muscles that allow for a wide range of motion from scratching your head to throwing the perfect pitch. However, this wide range of motion can come with a price. It can lead to increasing problems with stability or impingement, producing both acute and/or chronic shoulder pain. Your shoulder is made up of three bones: the humerus, the scapula, and the clavicle. The head of the humerus fits into what is called the glenoid cavity, forming the glenohumeral joint. A combination of four muscles and four tendons keep your arm bones centered and stabilized within the glenohumeral joint and is referred to as the rotator cuff. The four rotator cuff muscle attachments originate from the scapula and insert onto the humerus. The many tissues in the shoulder can become inflamed and painful, making daily activities such as combing your hair or getting dressed difficult. Shoulder problems for which PRP and stem cell injections are used fall into five major categories: bursitis, tendonitis, partial rotator cuff or biceps tendon tears, osteoarthritis, and impingement. Bursa are small fluid-filled sacs around joints that act as cushions between bones and the overlying soft tissue and help to reduce friction between the gliding muscles and the bone. Sometimes excessive use of the shoulder leads to inflammation and swelling of the bursa between the rotator cuff and part of the scapula known as the acromion. This is referred to as subacromial bursitis. Bursitis is commonly associated with rotator cuff tendonitis. A tendon connects muscle to bone and when becomes injured and inflamed produces an acute or chronic pain syndrome referred to as tendonitis. Most tendonitis is a result of wearing down of the tendon that occurs slowly over time. Tendonitis can be acute due to excessive ball throwing or other overhead activities during work or sport. Tendonitis can be chronic due to degenerative disease like osteoarthritis. The most commonly affected tendons in the shoulder are the four rotator cuff tendons and the one biceps tendon. The rotator cuff is made up of the four small muscles and their tendons that cover the head of the humerus. Your rotator cuff helps to provide joint stability and motion. Splitting or tearing of tendons may result from acute injury or degenerative changes in the tendons due to advancing age and/or wear and tear that is accelerated by poor nutrition. Rotator cuff and biceps tendon injuries are the most common injuries involving the shoulder. Rotator cuff injuries are most commonly seen in tennis, baseball, volleyball, rowing, and bodybuilding. Shoulder impingement also occurs when the top of the scapula, your acromion, puts pressure on the underlying soft tissues when the arm is abducted, that is, lifted away from the body. As the arm is lifted, the acromion rubs or impinges on the rotator cuff tendons and bursa, leading to bursitis and/or tendonitis. Over time, severe impingement predisposes a patient to rotator cuff tear, either partial or complete. Shoulder impingement is common in sports that involve repetitive overhead movements of throwing, swimming, and tennis. Shoulder pain can also be due to osteoarthritis related to sports or work injuries and accelerated by poor nutrition. For years, professional athletes have had access to PRP and stem cell therapy. This therapy has allowed them to heal quickly and more completely from shoulder injuries. PRP and stem cell injections are why athletes with shoulder injuries recover and heal in a matter of weeks. These athletes are able to fully perform in a matter of weeks, while others could suffer for months or even years. Both active individuals and athletes who endure chronic pain from rotator cuff injuries, biceps tendonitis or tendon rupture, impingement syndrome, or osteoarthritis can get pain relief and a cure. Here at AAAPC, we provide the absolute most comprehensive PRP and stem cell therapy in the region. We have state-of-the-art fluoroscopic and ultrasound equipment to accurately diagnose and confirm your injury. This equipment also provides precise and accurate needle placement during therapeutic shoulder injections. We complement PRP and stem cell therapy with stem cell stimulating nutrition prescription, IV nutrition, acupuncture, and hyperbaric oxygen therapy. I'm so excited to provide this therapy for patients looking for a highly effective, most cost-effective alternative cure to surgery. It is so fun and rewarding to help people find a cure to their chronic joint and spine pain.